Hey, everybody, and welcome to This Week in Recovery. My name is Angela Gilgallen, and I am a member of the Lackawanna Recovery Coalition. I am also the CEO of Turning Point Alternative Living Solution, better known as TPALS. This week, we have Dr. Richard Silbert with us, an addiction psychiatrist who is here to discuss whether or not addiction is a disease or a choice. Thank you, Dr. Silbert, for being with us today. Do you mind giving us a bit of information about your background?
Hi, everybody. My name is Dr. Rich Silbert. Some of you have known me from past positions and activities I've had in my work life in the Scranton area over the last 35 years. Some of you may be sad to say I met at the hospital when it was CMC instead of GCMC, or in my practice, or at meetings, or at a rehab. I've done this for about 40 years now, probably a bit longer. And I'm both an addictions doc and a psychiatrist. And I'm now working for Community Care, which is the UPMC-owned managed care organization that watches over many of your benefits if you're on either medical assistance or some other UPMC insurance plan. I also am president of the Pennsylvania Psychiatric Society for the state. So it's been a busy year with all the worries about epidemics, whether they be the opioid epidemic, methamphetamine epidemic, alcohol hasn't gone away, and of course the COVID. So it's been a busy time, and I'm happy to have this opportunity to speak with all of you on an important subject, which is alcoholism and addiction, is it a disease or is it a choice? Thank you, Angela, for starting me off.
Thank you, Dr. Silbert. What motivated you towards becoming an addiction specialist?
Well, there was a number of things that went on in my life. And I think the very first thing maybe bears mention, even though it's probably not everybody started into addictions. My father couldn't stop the use of nicotine. Sometimes we forget that tobacco and nicotine and vaping is an addiction also, and it cost him his life when I was at a relatively young age. So later on, when I was in training, and I was in Philadelphia at the time, and now the place is called Kirkbride. It used to be called Institute of Pennsylvania Hospital, but I was on a program there, and I thought, gee, these are a bunch of, caring folks and folks in need, both, and treatment was necessary, and I got hooked on it and continued ever since, working both in the psychiatry field and the addictions field.
Thank you, Dr. Silbert, for your feedback. Why did the American Medical Association classify addiction as a disease?
Well, they took their darn time doing it, even though we're not talking about, maybe for you it's ancient history because it was before you were born, but in 1956, they finally decided as an organization to call alcoholism a disease. There had been doctors and scientists for as long as maybe even 200, maybe not quite, but 200 years who have been talking about this. Probably the most famous one for me, because he has Philadelphia roots and there's places devoted to his both guidance and and lead, was Benjamin Rush. And Benjamin Rush talked about, even in the 1700s, alcoholism not simply as a disease of poor will or poor choice. He talked about it as a medical disease, and it wasn't until much later. So we're talking about the 1950 time era, where the founders of AA and other people made a concerted effort to get everybody involved and on the same page to understand that alcoholism and later on addictions were a disease that followed the same course in the medical world that other diseases, whether it be diabetes, pulmonary disease, heart disease, that alcoholism and addiction had the same signs and symptoms, but not till 1956 and not till 1990 or 91 was alcoholism and addiction listed as the type of medical and or psychiatric disorder that had billing codes for insurance companies. So it wasn't until then that many or most of the insurance companies agreed to acknowledge that it was a disease and pay for the medical and psychiatric treatment necessary.
I'm wondering, can you help our audience identify as far as what ASAM or the Medical Association defines addiction as a disease?
Sure. Just so I don't forget something, I may peek at a note or two, but basically, um, when you have a disease, you have things that happen to your body, and in this case, part of your body is your brain, that changes its structure. And these aren't things that are part of an injury. So that's how a disease is defined, that there's signs, symptoms, changes in the body and how it functions. And again, in this case, the brain, that are typical. And you can see this in a number of different people. And the course goes a similar way, especially if it's not treated. And it does require specific treatment. So again, everything about alcoholism and addiction follows the same set of definitions that would be true for any other disease. Now, even without your prompting, I'm going to throw out a few things that we've come to know through the years that's part of alcoholism and addiction. One is that you can no longer use the same amount that you used to use or drink and have the same results. And even though you try, a lot of times, or most of the times, you just can't make any difference in the amount that you're using. So even though in modern day science, they no longer require, as part of the definition of alcoholism or addiction, physical withdrawal or extreme tolerance, you do see that often. But what you'll pretty much always see is that people notice, and other people notice sometimes before they do, that their use has increased and no particular urging or no particular attempts stop it. Other things that are noticed are that people will not be doing so well in their social life and in their work life, even to the point at times of being abusive to some other folks. So all of a sudden, people's job function and family function has gone downhill. People notice urges or cravings. People notice that there's moodiness and there's sleep and eating problems. So these are a lot of, and I'm sure they're, quite familiar sometimes in even a sad way to lots of folks, tuning into this interview. But these are some of the characteristics that even as doctors, we look for. As doctors and scientists, we look for some other things, but those are, some of the main ones that people can look for.
I believe you covered my following question, which was going to be, what is your process for diagnosing someone with substance use disorder? Is there anything else you'd want to add?
Well, doctors also do things, of course, like lab tests and physical exams. Physical exams, very important. And, basically, if a person's liver is enlarged or they have changes in their skin and their vasculature, where their veins are showing their signs, and the blood tests, even if it wasn't blood test specifically for alcohol or drugs, blood tests will also indicate that there's dependence or disease going on, because even things like blood cells change when there's alcoholism and addiction.
So once you have identified somebody with substance use disorder, what are some of the next steps with connecting them to treatment?
Well, I think the most important thing when the diagnosis is made is first developing a partnership with the person who's making the determination and the person who has the disease. And education is extremely important, but folks who work with folks with alcoholism and addiction have to engage that person. You know, it's their body, it's their brain. And you know, my position through the years was always they have to get just about as much expertise as I have, and maybe in a lot of ways they have more expertise because they've done more living through it. So I think the first part is have an alliance or an engagement or a partnership at working on things. The next step would be figuring out what's the level of care that a person needs. So the largest amount of people with alcoholism and addiction can be helped through outpatient services, and they need to get started, you know, together with a clinician, whether it's a counselor, therapist, in some cases a psychiatrist. They need to get started with somebody they can work together with, and you know, go ahead and together with their clinical work, learn about, we call them mutual help groups now more than we call them self-help groups, to figure out which ones would work for them, because there's more to this than just a weekly or a individual meeting or a group meeting to supplement what other things are done for alcoholism or addiction. Usually a doctor has to be involved because there's physical exams, and usually they're you know, for many folks, especially those with opioid use disorders, but sometimes folks with alcohol use disorders, there needs to be medication-assisted treatment involved also. That's certainly had more attention these days because with many addictions and alcoholism, some people just won't respond without medication-assisted treatment. So there's many different steps to get started, and outpatient treatments and assessments are the first, but sometimes people need inpatient care. In some cases, it could be a hospital-like setting, but a lot of times we're used to talking about rehabilitation centers, which are residential, not necessarily highly medical places. And sometimes people need psychiatric care because they have co-occurring disorders. And that's very common in the world of alcoholism and addiction. We've come to say that that's more of an expectation than a rarity, since some statistics say as many as 40 or 50% of folks will have, aside from their alcoholism and addiction, other behavioral disorders, possibly a depression, other types of depression, other types of anxiety, and psychiatric disorders. So that's how folks get started in treatment. A lot to do.
Yes, thank you, Dr. Silbert. I love how you led with the education, because I think that's a very important component. We can't change anything if we don't know that there is a problem or a solution. And I think education is what the Lackawanna Recovery Coalition intends on implementing within our community. So thank you so much. And that's all the questions that I have. Is there any other thoughts or anything you want to add?
I think just because it's probably my bad that I didn't emphasize this earlier, but it seems sometimes unusual to me that here we're in the 2020 era, and there's still folks out there in the world that think that folks are just somehow weak-willed or have bad morals who wind up having alcoholism or addiction. Sad to say, they don't understand that there's family, genetics, stresses, the environment that all go into addiction and alcoholism. And I'm hoping that with education that's available, not only in this format, but other formats, that people who still, sad to say, look at somebody in a stigmatizing, with stigma kind of way, and say that that's a bad person, or that's somebody who hasn't, lived the right kind of moral life or gone to church or synagogue enough that they get over that and understand that in the world we live in, our brains change. And doctors and scientists know they now have neurologic studies and brain scanning and can see the changes with alcoholism and addiction where things change. And that person, once they had that change in their brain, it takes a lot of work to get themselves back into recovery. So I'm hoping that all the people who might be listening to this interview don't feel, any kind of embarrassment or put off by other people who would say such a thing, and do enter the appropriate treatment. This is a disease, not a matter of poor choices or poor morals.
Thank you, Dr. Silbert, for a very informative discussion. And thank you, everybody, for joining us for This Week in Recovery.